evening. Over to
And Emily, guess what? Our good doctor over here has his coffee, so we're going to be talking to Dr. Acevedo. But we want to tell you that May is Stroke Awareness Month. It's the third leading cause of death in the United States. There are things that you can do to prevent it, plus early warning signs to look out for. And joining us is Dr. Paula Acevedo, the adult neurologist for the Neuroscience Center at St. Mary's Medical Center. First of all, good morning. Welcome.
Good morning. Thank you very much.
It's kind of the staple for being a physician, right? Have a little cup of coffee.
It is. We start out early, and we get our day started very early, like you all. But you guys really take the cake.
We're so glad you're with us, talking about stroke prevention. Let's talk about some of the things that you can do. Caffeine, alcohol. Just what are some of the things? Are those necessarily variables in trying to prevent stroke?
Sure. I think the key there really is moderation. I don't think you want to have an excess intake of caffeine. However, a little bit of caffeine in the morning is a positive thing. It's a stimulant of the nervous system, as you well know. But smoking is certainly a bad thing. We culturally have used smoking as one of our crutches, if you will, and it's a process that is really damaging over time for the brain.
And I imagine weight being a big one too, nutrition.
Sure. So there's so many things that we can do with our daily habits: diet, smoking cessation, moderation with alcohol, with caffeine, etc.
And are some people more genetically inclined maybe to get a stroke?
Absolutely, yes. Unfortunately, there are people that have a predisposition to having blood vessel abnormalities that can cause early onset of stroke in the population.
So let your physician know about that family history. Okay, warning signs. You hear about the slurred speech or maybe the numbness on the one side. Is that necessarily a warning sign?
Yes, it is. Slurring of speech is one of the more frequent signs. However, also a numbness or tingling in the extremities, as well as a typical headache, or a headache that is more severe than usual, as well as visual changes, are also very important. If you present with visual change that is that lasts for any amount of time, certainly a physician should be consulted, and if not, the patient should call 911 or be taken to the emergency room immediately.
And you guys have a comprehensive center over at St. Mary's, but I imagine that first visit is with that family practitioner, or if you say in a more severe case, calling 911.
Right. When talking about stroke prevention and stroke awareness, usually the primary care physician, or the family practitioner, if you will, is the person that starts the process, and the caring mothers and fathers of their children that keep an eye out for patients or children's obesity, etc. However, when necessary and there's an emergency situation and when things have already happened, a comprehensive stroke center is very important to have, and we're very fortunate here in West Palm Beach to have St. Mary's, because we have an interventional neurologist, we have a complete neurology team at the ER that can help man the stroke center.
All right, Dr. Paul Acevedo from St. Mary's, thank you so much.
Absolutely.
Learned a lot about Stroke Awareness Month, and this is for the month of May.
And thank you very much for the call.
Not bad?
Thanks. Wonderful.
Okay, good. All right, get your cup of coffee, Emily. I didn't know that. Maybe, you know, like you said, it sparked the neurons a little bit over here.
Yeah, you keep hearing all these studies about how coffee does well for you. So if you're waking up with us this morning, you can grab your coffee and feel good about it. It is 6:18, and we're going to move on for you, talk to you about the news of the day as you wake up and we get your day started off right. You know, there are many